Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back, everybody. Welcome back. You're listening to Living Pain-Free, the educational program. We're talking all things sports medicine, regenerative medicine. Maybe you're considering an elective orthopedic surgery, and you want to know what else is out there, right? Or maybe some healing treatments that you can get to avoid going underneath the knife and going to the operating room. And that's where something like regenerative medicine come into the conversation. So I'm Dr. Thomas Grove. I'm a physician. I'm fellowship trained in sports medicine. I've been injecting with PRP and stem cells for well over a decade. Very powerful stuff that we have here. Again, what we do is we take the body's healing cells, concentrate those cells down, deliver them under ultrasound image guidance into areas that we want to heal, right? We treat head to toe, right? Little joints, the fingers and toes, shoulder, hips, knees, ankles, any sort of soft tissue structure, muscles, ligaments, tendons, you name it. These are all things that can be addressed. Again, using proper image guidance. The big key is figuring out, where your symptoms are coming from. So, again, very, very important that when we're bringing you in, we're spending time talking, figuring out what's bothering you, doing a good history and physical exam and scanning you with that musculoskeletal ultrasound to figure out, where your symptoms are coming from. And then from there, if it's something you think that would be a good idea to address with regenerative medicine, again, you simply get your treatment and you walk out, right? We're not dealing with any sort of major surgical complications that come along with doing a major invasive surgery. These are simple injections, right? We use small needles, use image guidance, a couple of pokes, a little bit of pressure, and you're out the door. After a typical sort of treatment, might have some stiffness and soreness for a couple of days. That's just the initial inflammation that we expect after a regenerative medicine treatment. After that, little brief offloading period where you take it easy for the exercise for a couple of weeks. We bring you back, see how you're doing. Again, some folks get great results with one treatment. Others require multiple rounds of treatment. So we always just do, one at a time, and we see how your body responds. It could be a couple of days, weeks, sometimes a couple of months before you have some significant improvement in your symptoms. But the idea is, these are healing treatments, right? These cells are involved in the healing process. So you get to actually regenerate and rejuvenate these injured areas. Contrast that with your traditional pain medicine, which is going to be pain pills, steroid shots, maybe high doses of an NSAID medication, which is a non-steroidal anti-inflammatory drug, like an ibuprofen, meloxicam, Motrin, things like that. Maybe you get a steroid shot with cortisone, for example, right? These treatments are very strong anti-inflammatory agents that come with a big side effect profile, right? The big one is it actually damages the tissue. So when you're doing these sorts of treatments, especially multiple rounds of something like a steroid shot, many times you're going to make that problem much, much worse. Anytime I get folks who come into the clinic and I've had, 5 or 10 steroid injections into an area, I start cringing. I'm like, oh my gosh, this is way too much. This is something that we know damages tissue. Why are we still doing these sorts of treatments? The alternative to that is, again, using things like platelet-rich plasma or stem cells, which is under the umbrella of regenerative medicine. Key word there is it regenerates, right? It actually heals the tissue, which many times can, decrease your pain, improve your symptoms, increase your function, and put you back in a position where you can exercise again, with the main goal being, get you back being active and keep you out of the operating room, having an unnecessary elective orthopedic surgery. So if you guys have any aches or pains or considering a surgery, have some questions about sports and regenerative medicine, give us a call here. That number to talk to me live in the studio on Living Pain-Free. Again, I'm Dr. Thomas Grove. Number is 866-870-5752. That's 866-870-5752. If you give us a call, we're going to send you a copy of our book for free. That's Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And if you're ready for a free consultation over the phone with our staff, that number to call is 800-300-9300. That's 800-300-9300. If you want to check out a fantastic free resource for you guys, check out our website. We're at www.jointrehab.com. www.jointrehab.com. That's www.jointrehab.com. Spot on every page for you guys to send us an email. Get in touch with us. See if regenerative medicine would be a good option for your ache or pain or any ailment that you have going on. So great resource for you guys to get in touch with us. Speaking of which, gets a lot of emails. I got one here, I think this is yesterday. This is a good one to talk about here. So someone who has an email that reads, I don't have arthritis in my hip per my x-rays, which didn't show that I injured it. However, my hip has intense pain around the joint down my hamstring. I took a cortisone shot, in parentheses, hated it. No results of improvement. Is it the muscles because they don't seem to know where the pain is coming from? ? So this is a very, very good talking point here to bring up here, guys. So like we talked about earlier in the show, yeah, you can have an x-ray which shows that you've got some issues with a joint, right? Maybe you do have some arthritis in the hip, but the pain is actually coming from outside the joint, right? In this case, this is somebody who says they have some imaging and they did not show any arthritis, but they've still got some pain there, right? So what gives with that? Well, they said that they got an x-ray. So if you guys don't know this, x-rays don't really show soft tissue very well. They're good for bones, right? You got bone cancer, bone fracture. Certainly x-rays can be great. A joint dislocation, for example, you could pick that up on an x-ray. But in terms of the muscles, the ligaments, the tendons, those sort of soft tissue structures, x-ray is not really going to show you that, right? So very, very important that we make that determination. And this is why I'm such a big advocate for that ultrasound, which is really the gold standard for this kind of stuff, is I can see that soft tissue structure in much higher definition than the MRI in a dynamic nature. So again, this is somebody who says they've got some pain around the hip. That could be a number of issues. There are so many muscles, ligaments, and tendons, soft tissue structures around that hip that could be causing issues for somebody. So again, this is somebody, when I read an email like this, I'm like, oh, please come into the clinic. We got to figure out what's going on. Get you off of that traditional pain medicine model with cortisone shots, pain pills, which inevitably just leads you down to surgery, right? So when I see an email like that, I get excited. I'm like, man, get into the clinic. Let's take a look at you. Let's see exactly what's going on with you. So we got a caller coming to us here from Ventura. We've got Arturo. Arturo, how are you this morning?
Hi, Dr. Grove. I'm doing well. Thank you.
Excellent. How can I help you, sir?
Yeah, I wanted to call in because I've had a few treatments at your clinic, and they've done, I've progressed tremendously, but I wanted to share with the audience how I guess you were, I guess there's no other way to say it, just superior to the treatment I was getting with some orthopedic surgeons. I had a pretty complex, issue. I had a tear on my hamstring tendon that attached on the back of the knee on the inside, and it wasn't just the hamstring tendon. When I saw the anatomy, it was like 5 different landmarks that were affected. And I think when I went to see you used your ultrasound, and you said, hey, you have a little tear, or you called it a rent, of my posterior joint capsule, which you told me wasn't even inside the joint space. It was outside of the joint space. And when you said that, I got really hopeful. And then, you did the treatment. You gave me the PRP and the stem cells, and I was hopeful that would actually solve my issue. And then, sure enough, with time, that actually got me a lot of relief. But prior to that, I had gotten several PRP and stem cell treatments with orthopedic surgeons, and they had this explanation that I think just was wrong. They said that eventually, if they inject the joint space, it would eventually migrate to the area where I had my issue. But that just never happened. And so I learned the importance of having someone like you who knows what they're seeing on the ultrasound in real time, so that they can get the medicine right where it's needed. And so I just want to thank you. I'm really happy with the results so far.
Arturo, man, I really appreciate you sharing your story. Yeah, I actually was just talking about it at the top of the program. Someone had some very similar issues. Yeah, it's one of those things that if you don't know what to look for, you're probably not going to find it, right? It's a much easier thing to just do one injection and do it blindly in the joint, and you see 50 patients a day, and it's like, all right, well, good luck. Let's see if it works. But again, taking the time with the patients, getting the training in that ultrasound. To the point that, that you, the patient, you can actually see what's going on as well. And then as you're getting the treatment, right? I mean, I've been there many times myself where it's like, man, I got this ache or pain. You get that needle, right on the right spot, right? And it's like, yep, that's it, man. Yeah. That's exactly where it needs to go. And again, when we're looking at things like joints, it's very, very important to determine, are your symptoms coming from inside the joint or outside the joint, or is it a combination of the two things, right? And again, the way that we do that, you got to do a good hands-on physical exam. Again, loving using that ultrasound to kind of back up what our findings are. And then when we're doing those sort of injection series as well, like I talked about earlier, very tricky area to inject blindly without any image guidance. This is where you can leave your patient with some pretty nasty side effects, especially back of the knee. Lots of big nerves and vessels, arteries, and veins in that area that you did not want to be injecting, certainly. So again, using image guidance, especially this little area, man, I can get away with a little 30-gauge needle, a little small needle, to address these sorts of issues. But again, if I just put it in the joint, we're probably not going to get the best results, right? In a case like that, where if we've got something on the outside of the joint that we have to address there. So again, it's, just getting back down to basics, figure out where the problem's coming from. And then, we got to deliver the cells where they need to go, right? And that part is not a process that you want to rush, right? When you're doing that first initial consultation, making sure that we're figuring out, okay, yeah, you might have some issues on the image, but if that's not where your pain's coming from, that's probably not an area that we want to go after with these sorts of treatments. So it's a very fun, very, very satisfying thing we get to do for folks to, again, keep you active, right? Keep you out of that operating room, get the function back to this body part. So we're thinking about things like the knee. Man, that's an important body part now. And Arturo, you're an active guy, right? If I want you squatting and lunging and living your life, living your purpose. And if this is something that's a limiting factor for you, and, especially, as a young guy, you start talking yourself into these surgeries, right? Especially in this area, we get this a lot of confused with some meniscus tears in the backside. So we'll see pathology on the image. We get these sort of meniscus surgeries where they trim out meniscus, trim out cartilage. And now you're, 40s, 50s, and you've got really accelerated arthritis. Very common thing that I see in the clinic is folks that have had, 2, 3, 4, 5 meniscus surgeries, and now their arthritis is much, much more advanced than it would have ever been. So again, what we'd rather do, back to basics, man. If we can heal this up with injections, that's such a safer option to go. Again, while I got you on the line here, so in terms of your kind of recovery from this process with the injections, tell me about the soreness that you had after injections. How long did that last for you?
The soreness lasts for a few days. And then I kind of get back to the baseline that I was at before. And in my case, I think it took probably, it's funny because other doctors have said, in about, 6 weeks or so, you should get the healing. But I didn't really notice increased strength in those tendons until about maybe 2 months. And then into the third and fourth month, I kept noticing more improvement. So the pain from the treatment, it only the little flare up, it only lasts for a day or two, and then the wellness takes longer to kick in, which I've learned to be patient. And you told me, that I needed to take it easy for a couple weeks, but yeah, I've just learned to really get the most benefit, I have to be patient. And that's okay with me. I've had experiences in the past where I rushed an injury recovery, and it just doesn't go away. You could be aggravating an injury for, I would say, indefinitely, for a year, couple years, even longer. And now I learned my lesson the hard way. Just give it time, and the PRP and the stem cells just give you so much more healing.
Yeah, absolutely. I really appreciate you saying that. It's something that it's always helpful to have a patient, come in and talk about their experience. Because as a physician, a lot of times people don't really understand. I mean, I've treated all over my own body. Again, this is why I'm so bought into this sort of therapy. Is it works so well for me, so well for my family that I continue to treat. The thousands and thousands of athletes that I've treated over the years, and that healing journey is very different for everybody, right? So I've had folks that they'll walk out of the clinic and they're like, man, my pain's already improved. I don't know how that's possible, but it's something that certainly happens within the first couple of days. Some folks already have relief. But, in terms of, the hard science and research behind this sort of treatment is we know this healing process continues for a couple of months at minimum, right? Some studies will suggest even a year or more. And as you're going through that healing journey, I know it's really tough to not be physically active over that area that we treated. That's the best and the worst part of my job. The best part is I have an active population I get to treat. Everyone's itching to get back to exercise. And the tough part is getting people to stop exercising, right? I always get a handful of patients every year that after I do an injection and I'll tell them, hey, listen, not a good idea to exercise on this body part. They run a 5K, they run a half marathon, they do a 20-mile hike in the mountains directly after a treatment, play 36 holes of golf, for example. Those are all things that don't really lend themselves to good optimal healing. So good on you for, taking some time and giving that knee a little rest. Because when that happens, we get really, really great results. This is where our success rate really climbs, is when patients are, properly following the aftercare instructions. And again, the beauty is, Arturo, you're still able to do a lot of exercise, right? You can do things on the other leg, for example. You can still hit the core work, right? Upper body, still keep yourself in shape, which I think, aids in that healing process as well. So that's something I always try to tell folks as well. They start complaining, well, hey, I got to take a couple weeks off exercise. That's going to be tough to do. So many times, it's just we, limit exercise to one sort of, body part, right? The area that we're treating. But you can still get away with a lot of good exercise otherwise. So it's a time to maybe focus on, the upper body, for example, if we're doing a set of knee injections on somebody. So very, very important that you follow that because, like you said, sometimes that process takes a couple of weeks into months before you're having, significant sort of pain relief. But the feel good thing is, man, once you feel better, we know that tissue's healed up. Then you can go back and use it again, right? We're not dealing with a major surgery where you need to mandatory take a lot of time off, and with that, typically you're not exercising at all. Which now leads to a lot of muscle atrophy, and now you got to do months and months of physical therapy to get back to a baseline. But with this, we can still be pretty active, right? So like for the knee, for example, you can still walk around on it, still do your daily tasks, but nothing that you want to, specifically exercise that area. But yeah, good on you, man. I know it's tough to take some time off, but when you do and you allow this stuff to work, man, it can be pretty powerful.
Yeah, absolutely. And that is the exciting part, is that once the healing is done, it's a new structure. You have an improved quality of the tissue, and I can feel that. I can feel like, in fact, right now I'm like, man, I really feel like I could go and play some pickup basketball, and I'd be pretty good actually. I feel like I could plant on my foot and really push off hard off the ground and jump. But I'm not. I'm taking my time with it still. But yeah, that's super exciting. It's not masking anything. It's literally rebuilding the tissue into almost like brand new tissue. And so that's the best I think that can be done. And I'm excited when the time comes to really make the most of it and get back to pretty much full activities, high intensity stuff like that.
Yeah, I love it, man. I love hearing that kind of, report from a patient, and just to talk to you about, what we're actually doing for folks. So again, when we're addressing these issues, earlier, right, we're not allowing these little problems to become big problems. So especially for something that's outside of a joint, now we're looking at the supportive structures of this joint. And so if we have, again, these little injuries and now that becomes a bigger injury and now that joint becomes less stable, right? A lot of times that's going to cause a pretty quick acceleration of any sort of condition that's going to be, like arthritis, for example, because now we have a lot less stability of that joint. So, I always try to encourage folks, when you have injuries like this, man, get on top of them. Because if I can get to this sort of injury at a young age like you are, Arturo, we're not dealing with a really shredded joint at 50 or 60 years old, right? Like a lot of folks that have gone down that traditional route where it's cortisone shots, pain pills, you're masking the pain, you're doing more damage. And now when you kind of get out of that, and you're like, man, I'm so tired of this. You see the light at the end of the tunnel saying, listen, I'm not really getting anywhere with this sort of traditional pain medicine model. And that's typically where I see a lot of folks, right? And so I'd much rather get to you early like we're doing with you, to allow you to continue to live a very active lifestyle. And then when you have a little problem like this, you take care of it, right? You get it healed up, and now you're coming out of this injury with a stable joint that with confidence is healed up, and you can use this thing again, right? Now it's not going to make you injury proof, right? And people always ask me that. It's like, well, is there a guarantee I'm going to be pain free forever? It's like, no, of course not. That's nothing that we can certainly guarantee. But again, we get you healed up, right? You can get back to using that tissue again, and then hopefully, Arturo, if I see you again for this knee, it's because you just had some kind of weird injury. You had a slip and fall. You had something else going on. But typically, when you take care of that body part, this is not something I'm going to continue to see you for, every so often. So it's a very feel-good thing. Again, the side effect profile of what we're doing is so ridiculously low. This is not like a cortisone or a pain medication that your body literally metabolizes and it wears out. This is a healing process, right, which can last at least a couple of months. That healing process will kind of taper down. But it's not like we're, going to come out of this and your pain's going to be a lot worse because of a side effect of the treatment, right? This stuff, it heals tissue, right? I mean, that's really what the side effect is. So pretty powerful stuff, man. I'm really glad that you're getting great results.
Yeah. Thank you so much, Dr. Grove. I appreciate all your skills that you've built up over your career, because I'm the beneficiary of it, and I'll continue to come to you for all my needs when it comes to this kind of stuff.
Archer, I appreciate you, man. Again, thank you so much for sharing your story, and I'm glad that we're getting you some results.
Thank you. Take care.
You as well. Have a great day. So a great call there, guys. Again, a great reminder that sometimes healing takes a couple of rounds, takes a little bit of time, and when you follow those aftercare instructions and you have a good foundation of figuring out where your pain's coming from, using good quality cells, deliver them with as much accuracy as you can using ultrasound, it's no surprise to us we can get some great results for folks. So it's always fun, hearing success stories and testimonials like that, and then learning about what that journey looks like, right? This is an individual that took a couple of treatments. At this point now he's probably a couple of months out from his first treatment before he's having significant results. And that's, it's pretty normal. It's within the normal range. So, having realistic expectations, knowing how this whole process works, I think really assists in that healing process. And staying patient is definitely one of them, right? And even more important is staying positive, having a good positive outlook and attitude about your recovery, and looking at the bright side, right? This is a guy that, had a knee issue, and we can still keep him active, right? So he's taking the energy, putting it somewhere else in a positive way. Meanwhile, that tissue is going to continue to recover and heal. And as we do these follow-up appointments with folks, that's how we kind of figure out, hey, when are we ready to, cut you loose and get you back to activity? And that journey is different for everybody, right? A huge part of what we do is, thinking about really great customer service, making sure we're keeping tabs on you, seeing how you're progressing, bringing you for follow-ups, when we need to. If you have an injury, you want me to scan it again, just take a look at you, help guide you down that path to healing. And again, we're available. I talk a lot about other lifestyle issues with folks too. How do we optimize that healing process? Those are all very, very important factors in terms of getting people great results. So a couple more minutes here, guys, left in the second half of our segment. You're listening to Living Pain Free. I'm Dr. Thomas Grove. That phone number to call and talk to me live in the studio is 866-870-5752. That's 866-870-5752. That's the end of our show here, guys. Thank you so much for tuning in. Really appreciate you guys listening. And if you're interested in a free consultation over the phone with our staff, let me go with that phone number. We're at 800-300-9300. That's 800-300-9300. If you want to send us an email, check out our website. It's about on every page of our site there. If you guys to get in touch with us while you're there, check out some videos of us doing the procedures and educational content. jointrehab.com. We'll see you next week.
You've been listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870 The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.